Hi guys, so I've had a few questions asking what medication I'm on, what braces I use, and just everything that I've done to get from where I was, which was bedbound, fainting, very sick, to where I am now, which is for the most part so much better. So I thought I would do exactly that. There will be timestamps in the description and in a pinned comment, so if you're just interested in medication or braces, then you can find that and skip to that part. So starting with medication, this is quite a personal video, but this is exactly what my channel is for. When I started this, I was like, if I find things that help, I'm going to share them. So the first thing I'm on is propranolol. Propranolol is a beta blocker, so it works by slowing the heart rate down, and for me, I'm on this for POTS. And I also have a really high resting rate, so it's helpful for just lowering heart rate. For me, this has really decreased my dizziness and my fainting. It's made me able to stand for a little bit longer and things like that. However, it does have the side effect of lowering blood pressure. So if your blood pressure is high, then this can be like a double job, you know, great. But for me, I also had low blood pressure, and so for low blood pressure and to counteract the propranolol, I'm also on midodrine. Midodrine is a medication which works to increase your blood pressure, and it does this by constricting the blood vessels and helping to bring that pressure up. With midodrine, it's done a similar thing. Low blood pressure can make you feel dizzy and things like that, so those two, I really see them as working together for me, but you definitely can take them separately as well. The midodrine is a strange one when you start it. It gives you this tingly goosebump feeling, so you have to be mindful of that, and for me it also caused headaches. However, after the first week or two, that really settled, and the benefits of the midodrine and having normal blood pressure far outweighed what I experienced in the beginning. So if you do start that one, you can expect to feel tingly, goosebumps, headaches, but it all subsides and gets better. The next few medications I'm on are anti-sickness tablets. Now, I really struggle with nausea in general, and I also have cyclical vomiting syndrome, which my episodes are quite severe and they trigger my heart and things like that, so I'm on a lot of anti-sickness medications. The first one is prochlorperazine. This also goes by the name Bucostem. So this is a buccal tablet, which means it goes in your gums, you don't swallow it, which if you're vomiting can be helpful. Although they say with this you won't throw it up because it's not in your digestive system, but if you're being sick, it will come out. Anyway, this is so good, and you can actually get it over the counter in the UK. It's not advisable to be on it all the time without your doctor's guidance, but if you deal with occasional nausea and vomiting and your doctors aren't willing to help you, you can go to the pharmacy or the chemist, ask for Bucostem, and it's sold as a migraine tablet, so for nausea associated with migraine. So you might need to just say you want Bucostem for migraines, and then they can give it to you. If you're going to be on it long term and regularly, like I am, then you will need a doctor's prescription, and also it makes it a lot cheaper. But if your doctor isn't helping and it's not so much of a regular thing for you, you can go to a pharmacy, ask for Bucostem, and they would like you to say it's for migraines in order for them to give it to you. So yeah, there's that. And I've tried a few anti-sickness tablets, and that prochlorperazine is one of the most effective ones. Actually, all of the ones I'm on are really effective, and they're the ones that I've stuck with. So the next one is promethazine. This one has a side effect of making you really drowsy, so I only take this at night. It's an anti-sickness, but it's also an antihistamine and a sedative, so it's used for a couple of different things. It can also be used for travel sickness, but I take this for nausea and vomiting at night. I often wake up in the night being sick, but this has greatly reduced that. Again, because of the sedative effect, to start with, I was feeling drowsy and headachy the next day, but then that soon wore off, and the benefit far outweighs any of that, and actually I don't get any of those symptoms or feelings anymore anyway. And the next medication I take, I'm a bit hesitant to talk about because they really don't like prescribing this to people in the UK because it's a really expensive medication, and so they just try to avoid it at all costs, and that is ondansetron. So for me, I dealt with sickness so much and they just let me be sick basically for a long time. However, recently my sickness episodes have been triggering cardiac episodes, which are quite severe, quite dangerous and quite scary, and so that was really when I got the ondansetron prescription. Some of you will know I had a private prescription in the past, but because of the nature of my episodes now, I was able to get ondansetron. You can talk about it with your doctor, but they don't really like giving that one, but it is so good, and not much compares to it other than the promethazine and the prochlorperazine, which I talked about. The next medication I'm on is cimetidine. Now this one, I have to say, out of everything I'm on, I understand this one the least. I know that it stops you producing so much stomach acid. I know that I'm on it for inflammation and like damage and stuff to the stomach from being sick so much, and also to try and stop me being sick. But I'm also on it for inflammation and damage to the bladder lining, so I'm on it for both of those things, but I don't know, I haven't noticed much difference with that one. I just take it and hope that the inflammation and stuff is less. I get my like the amount of blood in my urine and stuff tested, and I'm at the max amount that the dipsticks can detect, so whether that's less we don't know because I'm still at the max amount of blood. TMI for this bit, so I'd imagine that is helping, but like it hasn't fixed it because I've still got inflammation and bleeding and stuff. And lastly, for medication, I thought this one was worth mentioning, and that is the Sorel pill. Now this is because periods can interact with POTS and make your POTS symptoms a lot worse. That was the case for me, so I went on this pill. It's actually a birth control pill, which is why I'm saying this kind of is a different category. So the reason this one is a bit different is because it doesn't actually treat symptoms specifically, it treats the periods, which can make your symptoms worse. So yeah, I found that to be great. So I think that's everything for medication. If I think of anything else, I'll put it in the description or something. But moving on to braces, we'll start with these braces, which you can see here. I get so many questions about these that I really wanted to put it in a video, just so that I could talk about them properly and give all of the information that people are looking for. So I'll show you it on this hand. This is called a push ortho thumb brace for the CMC joint. So CMC joint is here, which means this brace, even though it covers all of this area and up here, it only treats this joint here. So if you get dislocations here, here, you know, anywhere else, this brace won't help you. However, for me, I had this joint chronically dislocated. It's actually much better now, and with the braces, it can stay in the joint, and my hands just in general are so much better. So that's why these braces really work for me. I need to put my hand down because raising your arms makes you really out of breath and dizzy if you have POTS. Some of you might have noticed that. So about this brace, it only does that one CMC joint. They're quite expensive, it costs about £50. Having said that, these were recommended by my physiotherapist and they're really, really good. It's slightly restrictive, but if you need the brace, then you probably would benefit from some immobilisation of that joint. So to recap, quite expensive, but recommended by physiotherapists, and they're amazing for that one joint. And how it's helped me is that my joint, which wasn't in the socket at all, is now in the socket, and even when I'm not wearing the brace, it can hold its own, which is brilliant. I used to dislocate these joints every time I pulled my jeans up, so that's much better now that those joints can stay in place. The next thing I have to talk about are these ring splints. I hope you can see it. It's a sterling silver ovalate ring splint from Eva Bell Jewellery. This is sold on Etsy. There are a few sellers who sell similar things. So this one is for the dip or DIP joint, which means the top joint of the finger. These, again, they're really expensive. These were about £20 each, so it's quite an investment, but if you need something like this, then you need something like this. I put off buying them for a couple of years actually, just because of the price. Like just for these two, that came to £40, which is a lot of money. So I'll show you what these do, and I'm going to be careful because these are my joints which dislocate and I have a lot of pain in, but without the brace my finger will bend and then dislocate. So you can see there my finger goes beyond being straight, and then when you wear the splint and then when you have it on, your finger won't really move past that straight point, and so that's how they help. So again, you can find this sort of thing on Etsy. I got these ones from Eva Bell Jewellery. They were really good and answered my questions, so I'd recommend that seller for that, but the price is a difficult one to stomach. And actually, before I bought these, someone recommended me to get a pop socket on my phone because holding my phone is what would dislocate this joint the most. But getting a pop socket, so one of those little things that sticks on the back of your phone, and being able to hold the phone that way really helped. And actually that's helped almost as much as these ring splints, which are really expensive. The next two supports I don't use all the time. So I wear these thumb braces and the ring splints all the time just because I need that stability there. However, I also use this one. This is called a thumb spiker. My physiotherapist recommended this, but she didn't recommend a specific brand or anything. I just found this online and so I ordered it, and this is really good for immobilizing the joint. So if I'm having significant problems, then I'll wear this. And I'm not sure if you can see, but it covers a bigger area, so it's not just the CMC joint, it covers the whole thumb going down into the wrist as well. And then the last one is this knee hinged wrap, again from the same company, which is Postural, and these are both from the Form Fit range. So this one I use because my knees dislocate at night. Well, it's mainly one knee, and I put this on at night to try and stop those dislocations. And then if I've had a dislocation in the daytime or something, then I will wear these for a period afterwards just to give my knee a bit more stability and support. But like I said, these two things weren't specifically recommended by my physio. So she told me to get a hinged knee wrap and a thumb spiker, but she didn't tell me the brand or anything. So you can search those things if you need something like that. It doesn't have to be this brand because I just found what I could find basically. And I should have also mentioned, you probably should run this past your doctor or physio just to make sure that you're not doing any more harm than good. These things were exactly what my physio recommended me to get, and so I know that that's what I needed. And then the other two, she'd given me the name and just said to Google it and find any. Because those are just supports and not braces, I guess that's why it could be any brand and it wasn't as specific. So I hope you found that helpful. Thank you so much for watching. Bye! Just before I go, I thought I should also mention these. These are just travel bands or sickness bands. A lot of people ask about those, so that's all they are. They don't help with stability or pain, literally just help with nausea. So that's what that is.